Welcome, Dr. Bart Billet. We're so excited to have you.
When choosing a non-invasive pain device, what makes you select EcoAI over TENS EMS units?
I really love it because it's so easy to use. As you know, TENS devices have wires, and patients, they try the TENS device for a couple of weeks, but then the wires are very difficult to wear. They have a lot of issues when they try to wear it at work or even at home, and then they stop using it really quickly. And furthermore, I think the TENS, it works maybe in the beginning a little bit because the feeling is different, but to work really in a different way and really patient-centered or patient-specific, I mean, then the EcoAI is much better. It's so easy to use, they can put it wherever they want. It's a click-on system, they know, they feel a difference. It's a completely different feeling from the TENS. It goes much deeper, because I even tried it myself to know what the difference between the feeling is, because the patients told me this. And you can feel it really going into the muscle. They have a different sensation and relaxation, which is really important, that it goes, it's not a superficial feeling. So it's an easy one. You just want the patient to feel comfortable. They can wear it under their clothes. They don't have to be, afraid that patients will see wires from underneath their clothing and everything. So, yeah, for me, it's a real added value for these difficult to treat patients. And I, of course, really like the outcome because they are so positive about it and they keep on using it, and they have the therapy. They have their own control over the therapy, and it's subjective, but I feel that there is less allergic reactions to the EcoAI system than to the TENS system, and that's something that is really important, because sometimes if you get a real allergic reaction from the TENS, there are not much options to change, and I feel that the EcoAI doesn't have that problem.
Why is a non-invasive FDA-cleared therapy like EcoAI important for chronic pain patients today?
I think it's reasonable nowadays that you need a device that's been approved by any authority, if it's FDA or European authorities. I think people expect that the device has been cleared and that it's perfectly safe. I think that's really normal these days. And of course, if you have a device where you can merge all the data from all the patients, there is more than 200,000 patients that are included in this therapy. You can merge all the data and get the best out of it. Patients feel more connected to the therapy, and they know they get more personal therapy. So in this way, I think it's a real added value that you can tell patients that you're treating them with a very good and reliable device that has been used by many patients, and that all the data is integrated, and so they feel connected more to the therapy, and I think the connection and the compliance will increase and you will get better outcomes. Well, that's what I see.
What makes EcoAI a key part of your clinic's treatment approach?
Mostly if you see a patient in clinic, they've been with many doctors, and many doctors prescribed medications. So they have a lot of medication going on, and there is a lot of medication that they have problems with. They have comorbidities that are coming, stomach aches, different headaches sometimes even. So if you can prescribe a therapy like that, or give them a therapy like that where they can diminish their medication and get really grip on the pain, and maybe even have the feeling that they can control it themselves by applying the therapy for an hour, half an hour in the morning during work, when it's the most severe painful period for them in their lives, that really gives them a feeling of control. And I think then you can really help patients and diminish the medication, and they will improve in many ways. You will get rid of the side effects and improve their pain. So it's a win-win situation that they really like.
Which patients do you prescribe EcoAI to, and where have you seen the strongest outcomes?
Yeah, I think the best responders are the ones with myalgia, and especially cervicogenic headache, because I think they're very refractory. They get sometimes a lot of medication, also Botox infiltrations, and I treated them with that, and there are 2 patients of mine who stopped having Botox. They have more control, the infiltrations are not needed anymore, and these are the ones that respond to the best, in my opinion. But also trapezialgia is also something that a lot of patients suffer from because of the chronic stress nowadays that patients have from work, from home, from financial problems. And so this, in my opinion, if you can wean them off benzodiazepines, because it's also sometimes an anxiety problem, it's mostly complex And if you can wean them off and give them control again, that's are the best patients. I also treated some CRPS or CRIPS patients where you can, proximal from the nerve damage, put a device and they have a very different sensation because the device really penetrates more than I expected and gives really a different feeling. So in that way, CRIPS is very difficult to treat and it doesn't it doesn't cure CRIPS, but it helps them because it's a very refractory disease. So it's added value, and again, if they can diminish medication because of this, it's a no-brainer to start a therapy and help these patients.
Why are patients increasingly choosing EcoAI over invasive therapies?
Well, again, these patients have been mostly treated for a long time, and they had most of them had even interventional treatments. And if you already have a lot of pain for a several amount of time, for a long time, then if you do interventional procedures, for them it's something they are scared of. They've had enough pain, they don't want another infiltration, they just want to start with, that they get the feeling that you understand the disease and that we can maybe do it in a mild way and not too invasive immediately and get that the patient trusts you, that you can give a therapy that works. And then you can see where you have to go afterwards. It's not an end stage, but it's something that they can already take a positive step, and then maybe afterwards you can do something else. But sometimes you don't even need to go any further. If the therapy is really what they want and what they need at that moment, then it's even good in some cases. So, but non-invasive therapy, I think, is the future.
With so many TENS options available, why do you prescribe EcoAI specifically?
I saw the device the first time when Dr. Chakravarti, the CEO of the company, presented it at an INS innovation meeting. And I was really attracted by the fact that there are no wires. So the wire thing from a TENS device is really a burden for patients. The compliance is low because they feel that the wires are always breaking or they're beneath their clothes. They are a bit ashamed of it. It's sometimes difficult to put it on. There is many patches. So I also think that if you can charge it yourself, there is no batteries because that's also an issue. And if you can charge it and then put it where you want, you have different patches. There are bigger ones, there are smaller ones. Not all the patients have big issues or big areas to treat, but also sometimes in the neck or going up to the head, and that is really sometimes an issue, and it's not possible with TENS, I think, or you have to shave up your hair, and it's a big burden. Patients don't do that. And then when I started doing it, or trying the first patients with EcoAI, and then I saw that the compliance was much better. These patients, they kept on using it because I had a lot of drop-off with TENS devices, and patients didn't want to continue using it. I had a lot more of allergic reactions to the patches, which I don't see at the moment, or not yet with the Nextim device, which is also a real advantage because then they completely stop using the therapy. And so in my mind, when I started using it, it's a no-brainer, and patients are so satisfied, and they have such an own control. They can wear it under the clothes, nobody sees it, they don't feel like a chronic pain patient or someone suffering, and they don't get these looks from what is happening with that guy or that woman. That's really important, and that's, I think, why the compliance is much better, and they use it much longer. If patients use it now for years, so they can keep their own therapy. They do it half an hour a day, 2 hours a day, whatever they want, whatever they think is best for them, and I don't have to tell them you should use it that or that. You just try it and make your own therapy and get control of everything, and then you're already a long way with treatment for patients, especially these with a lot of myalgic problems and superficial neuropathic pain. It's a real advantage.
Can you share a patient case that highlights EcoAI's impact and results?
Yeah, the patient that convinced me the most and got me so motivated to support the therapy and prescribe it much more and try to integrate it into my practice is the one that came to me with cervicogenic headache and occipital neuralgia, and she had every 3 months Botox injections with a neurologist. She also had occipital nerve infiltrations and pulse radio frequency with me, so she had like Botox. A month and a half later, she would come to me for occipital infiltration or pulse radiofrequency, and then a month and a half later, she would have Botox again to be able to work, because otherwise, if it was too long, she couldn't work. And then she started with EQAI next-in device, and then I only see her maybe twice a year when the winter is there and maybe she needs some extra support. But the Botox, she's not using it anymore, and she's so happy because she was so fed up with always these infiltrations which are painful and not durable. So this was really the one that convinced me to use this therapy more and to get more patients involved and treat them better.
How has your patient experience with EcoAI compared to traditional TENS units, especially in older patients?
In practice, I never use TENS anymore for older patients because there is too many wires, it's complex, they don't really understand how to use the therapy, they have to choose between programs, everything like that. We try to explain it, but when they get home, they forgot all about it, so they are really confused. With the EcoAI system, it's just, you put it there, you turn it on, there is all this data that gives them just the best therapy. They don't have to choose, they feel immediately that it's better because you already tried it. So there is a lot of confidence with the therapy and with the device. It's quite small, so they never run out of batteries and they can put it on most places themselves. It's a real advantage, and again, for the compliance, it's such an important thing. And the control they have, they can choose the patches, have a bigger area to treat, have a smaller one. If they need some help, they can come, but it's rare. Their partners can help them maybe put it on the back if they cannot see it, but most of the body is easily accessible and they can put it on there themselves. It's only a click system. It's so easy. So yeah, I think for the older population, this is the way to go. Using TENS with the older patients, but the EcoAI, because it's so, well, it's AI driven, so they don't have to do anything. So the best therapy is provided, which is such a relief for them that they don't have to look and for the best therapy and push all these buttons. They can increase it maybe a bit or decrease it maybe a little bit. That's depending on their feeling. But and it's always rechargeable from a physician side. You get all this data, and you know you're supporting other people as well. There is a lot of science behind it. There is a lot of applications behind it. So that's also important to know that you're giving a therapy that's been properly scientifically validated and that you're confident, and the patients feel that you're confident, yes or no. And that's really important, I think.
Across different age groups, have you observed any side effects with EcoAI?
Not really to my knowledge. If you compare it to TENS therapy, I would say there is, I don't see a side effect. Because the TENS is, well, I already said it, the compliance is poor, the material is difficult, there is always a choosing between programs. I don't see that, and I think what is a side effect? I didn't even see a failure of the device itself, of the hardware, so maybe that's something that can happen, or they ran out of patches, maybe they didn't order it fast enough. That might be a problem. But you know, even because they place it on different parts, they choose where they place it. There is also, I don't see a lot of adaptation to the therapy, like the effect weans off because they place it on different parts, and that's also something that I think is really important. That it's underestimated that you can, treat different areas because the muscle is big, and yeah. So,
have you seen benefits in muscle restoration or rehabilitation using EcoAI in your patients?
What I hear from patients, if they get, of course, if they have less pain and they feel more relaxed, because I think the muscles are absolutely treated in a better way than with TENS. They just move more. Do I feel that we might in the future look at that in an objective way? Of course. But if you can see if a patient is better, and if they are better, they move more, and if you move more, you get more endorphins. It's a positive cascade that you put into place. I should ask more if they move more. If I should be more specific on that in the future, but I think it's so a no-brainer to know and see them better that maybe in the future we'll see for more objective measurements, but in my subjective opinion, they do more, absolutely.
Where do you see the future of EcoAI, and what should be the next focus areas?
I think as we are already getting these objective data, maybe integrating even sleep patterns, actigraphy, everything like that, and then because I already did some studies with that, if you show the patient on maybe an app or on a device how they are improving, this has even a more positive effect on them, because they use the therapy, they see improvement, and they say, oh, I'm doing better, so this must work. So this positive reinforcement, it's a whole neurobiology circuit that gets into action, and that's what we need, to give the feedback back to patients, and then you can improve the therapy. Do we need to maybe advance on different things also? Yes, but I'm not on the R&D side, so I cannot comment on that, but I think that's the future. I think the positive feedback and the engagement of the patient, and to increase the compliance and to further objectify the positive outcome, that's the way to go.
Do you see potential for eco-AI data to help predict or identify emerging patient issues earlier?
I think if you get data from the patient at home, that's always a good thing, because if you see the patient at your clinic, they only say half what they want to say, because they leave and then say, oh, I forgot to say this and I forgot to say that, and maybe sometimes the physician is really running out of time, and maybe sometimes we have to be honest, we don't take all the time we need with the patient. So if you get a dashboard where you can get this feedback in a glimpse and see what you need to ask for, if they don't forget it, then I think it's a real added value. For me, for the therapy itself, I think we need to maybe use it more in the post-operative phase when they had a big surgery, and then maybe they have muscle aches because of they lied flat or they were immobile for an amount of time, and to help with the rehabilitation. I think there is still a big opportunity to use it, in my opinion, but I think we'll have to look into that in the future. But if for me, a new indication is maybe that if I see patients after surgery, big surgery, or the back or leg or knee or something, and it's going slow, and you can see that the mobility is slow, and then I think we should implement it even earlier on, and maybe try to treat it in an earlier phase, and then to accelerate the rehabilitation in that perspective, apart from the chronic pain, but maybe to prevent chronic pain in these patients in the post-operative phase. So I think there we can even use it more and to get more data from that.
How does your real-world experience with eco-AI compare to the clinical data?
Of course, it's subjective, but I see the positive result in my clinic, and that's why I wanted to participate in this project with Nextim to be able to produce more objective data, and to produce more outcome data and to publish it. I think it's you treat many different kinds of patients, and I think maybe we can do more phenotyping, and it's not invasive, so it's so easy to use. You don't have to do anything, and it will become clearer in the future that it is a good therapy clinically. I think the scientific data is already there, and because of the integration of the gathering of all the data, it will become clearer and clearer in the next months or years that it's really a good therapy. You have to, in my opinion, you have to try it for yourself also. You have to give it a chance and see that it's really a validated tool that you can use. You just have to look at your patients and work with them and optimize the therapy as you want, but you have to try it. I cannot put it in a different way. Just
Beautiful.
See the patient smile, and that's the thing to see and to work with.